Hi, everyone, and welcome to our webinar for port, border, and managed isolation facility staff on a COVID-19 vaccine. For those of you who don't know me, I'm Dr. Martin Lee. I'm a medical advisor for the Northern Managed Facilities team. As we all know, the rollout of the vaccine is fast approaching, and we wanted to provide you with as much information as we could. Speaking today, we have Dr. Nikki Turner from the Immunization Advisory Center, also known as IMAC. Nikki is an academic general practitioner and a director of IMAC. She's on several national advisory groups for immunization and COVID vaccines, including the Ministry of Health and PharmAC. We will also hear from Jane Morfitt, also from IMAC. Jane is a COVID-19 clinical education manager at IMAC, and she's led the development of the COVID-19 Pfizer vaccine training. Before we start, though, we're going to start with a 6-minute video, and then Nikki and Jane will speak after that.
Kia ora koutou katoa. I'm Dr. Ashley Bloomfield, Director General of Health here at the Ministry of Health. I really appreciate your ongoing commitment to keeping New Zealand safe from COVID-19. An effective COVID-19 vaccination program is a key next step in our elimination strategy to help us manage the pandemic. It's strongly recommended that you receive a vaccine to reduce the chance of catching and suffering from COVID-19. This video goes over some of the important details about the vaccine that we will be offering you. Today, you are being offered the Pfizer-BioNTech COVID-19 vaccine. The vaccine has been authorised for use by MedSafe here in New Zealand. MedSafe is New Zealand's independent regulator of all medicines and vaccines that come into the country. They check all the information from clinical trials and the information from the millions of people who have already been vaccinated with this vaccine. The vaccine causes our body to produce disease-fighting cells which prevent the COVID-19 virus from entering into our other cells in our body and making us sick. The vaccine's been shown to be very effective, around 95% at preventing COVID-19 illness. This vaccine uses mRNA technology to give our bodies the instructions to make a small part of the COVID-19 virus. The body makes a protein that is part of the outer shell of the virus, and this small part of the virus is enough to prompt our immune systems to make special proteins that attack the virus itself. So then, if you come into contact with COVID-19 for real, your body is primed and ready to respond. The vaccine is given by an injection with a needle in the upper arm and takes 2 doses at least 3 weeks apart. You cannot get COVID-19 from the vaccine. As with any vaccine, this one may not fully protect all those who receive it, and it will take a few weeks for your body to build up protection. After you have had the vaccine, you still need to follow official advice to help prevent the spread of COVID-19. This is particularly important because while it is known that the vaccine is effective at protecting people against getting the COVID-19 disease, it's not known yet for sure whether the vaccine prevents people from spreading COVID-19 into others. Before having the vaccine, a healthcare professional will run through your medical history to ensure it is safe for you to have this vaccine. Some side effects that you might experience include pain where the vaccine was given, tiredness, headache, muscle aches, joint pain, chills, mild fever and/or swollen glands. These are usually mild in severity and only last for 1 or 2 days. Generally, these are more common after the second dose of the vaccine. You can take pain medication such as paracetamol to ease these symptoms. Now, as with any medicine, allergic reactions are possible but very rare. Current evidence suggests a rare risk of a severe allergic reaction with this vaccine, about 5 per million. This is why we ask you to stay for 30 minutes after you have been vaccinated. If you feel unwell while waiting, please do let a staff member know promptly. They are trained to deal with allergic reactions if it was to happen. To finish, I'd like to go over some common questions people have about COVID vaccines. First, well, the vaccines have been developed very quickly. How do we know they are still safe? So, COVID-19 vaccines are being held to exactly the same high safety standards as any other vaccine. There are many reasons why these vaccines were able to be made more quickly while still being held to the same high safety standards. First, there has been significant investment internationally in the development of these vaccines, including taking financial risks such as building manufacturing facilities even before a vaccine has been shown to work. Researchers, policymakers and government officials around the world have been sharing information and working together to absolutely speed things up. There's been decades of previous research on related viruses that has been used to guide the development. And finally, because there is such a large amount of this disease worldwide at the moment, researchers were able to show that the vaccine worked much earlier than when dealing with rarer diseases. Another question is, do I really need 2 doses? Well, the clinical trials performed on the Pfizer vaccine show it is approximately 95% effective after receiving 2 doses. The vaccine is less effective after only 1 dose. How long will the vaccine protect me for? Well, we don't yet have the final answer for that because the vaccines have not yet been used for long enough to know. However, our research has shown that immunity following natural infection remains for at least 8 months, and we have every expectation the vaccine immunity will be even longer than this. Can I have this vaccine if I'm pregnant? If you are pregnant or could be pregnant, please discuss this with your vaccinator. I have children. Can they be vaccinated too? Well, at this stage, there's not enough data about the effect of this vaccine on children, so it is currently recommended for those who are 16 and above. Further studies are underway to address this very question. Thank you very much for your time. If you do have further concerns or questions, a healthcare professional will be available prior to vaccination to address these. Kia ora.
Okay, let's get started. I'll hand over now to Nikki.
Great, thanks very much. Kia ora koutou. We'll just start a screen share for this one. So what we were going to start with first was just a quick overview of some of the key common issues that come up, just so that hopefully this will answer quite a few of the questions to start with, and then we'll just go through some of the other questions that may not have been answered by this. So thanks for the opportunity to talk to people today, and hopefully we'll come back to the video. These are the general areas that we know most people want to be covered. The vaccine, what is the vaccine that will be offered? Is it going to work? And some of the common questions, how come it was developed so quickly? Will it be safe? And what are the things we still don't know? And what are the side effects after we have a vaccine? And then we'll move to the questions. So look, I'll start with some sort of background stuff that, many of you will be aware of anyway. But, the coronavirus issue, just to put it in context, coronaviruses are common respiratory viruses. And the problem with COVID is that it mutated to the point that none of us had immune memory to that particular variant. So that's the problem, but there are 4 seasonal coronaviruses out there now. They're pretty common. We've had a couple of other mutations in the past, but the problem with this one is the mutation meant that none of us had immunity to it. Now, this little schema here is a little schema picture of what the virus looks like. Now, it's a pretty simple virus for the amount of havoc it's causing, but the important thing is these little proteins sticking out on the surface of the virus. They're called spike protein. And it's called a corona because it looks like a crown, but it's those spike proteins that we respond to and create an immune response to fight the virus. So all the vaccines that are being designed are all focused on that little spike protein. So why do we want vaccines? Well, I think it's pretty obvious. We're all very aware that there's an enormous amount of burden of disease around the world. And New Zealand's been doing really well with its border protection and its control, but with the best will in the world and the best management in the world, we will still continue to get community cases. So vaccines are the next step in our armament to try and manage it. They're not the magic bullet. They won't solve everything, but they're an important next step. So the New Zealand Vaccination Strategy is looking at, what's the best way we can roll out vaccines to protect people as fast as possible. Now, the current strategy, because we have only very small amounts of community transmission, the people who are currently at highest risk of COVID in New Zealand are the border staff and their families and the MIQ staff and all of you people who are in contact with people who may be carrying COVID. So because you are the highest risk of catching COVID, that's why you're being offered the vaccines first. The New Zealand government has stated that no COVID vaccines will be mandatory and all COVID vaccines will be free of charge. So they have this, what they call a sequencing approach, that as we get vaccine into the country, there's certain groups that will get it first. Now, obviously, it's really important to understand that New Zealand's in a really different position from other countries. So North America, England, Europe, many other countries had enormous burdens of disease, and they went through emergency procedures to get vaccines out to their community to protect people as quick as possible, even before the completion of the clinical trials. Now, New Zealand has not been in that position, and so we've been in the privileged position of being able to wait a few more months till now we're getting our first supplies of vaccines, and we now have the clinical trial data, plus we have some really good data from experience in other countries. So it's a huge advantage not being the first cab off the rank. Now, what are COVID-19 vaccines? Well, here's a little picture of the virus, and you can see once again those little proteins sticking out on the surface of the virus. Now, what a vaccine does is it presents something to the body that tricks the body into thinking it's the virus itself. And then the body's immune system fights back, and the body's immune system then has a memory. When at a later date, you are exposed to the real virus, your body already has immune memory, and then it will fight it faster. So no vaccine is ever 100% effective for everybody, but a good vaccine, most people, after they've been vaccinated, either don't get sick, or if they do get sick, it's much more mild. And that's what we're seeing with these vaccines. Now, the new technology in vaccines, it's been pouring in the last 10 or 15 years. Medical science has come a really long way. And so the vaccine candidates that are coming through are really exciting new science that they're not necessarily the first time they've been used in COVID, but this is the first context that they've been used really widely in. So the vaccine that has come into New Zealand this week and will be offered to you folk is a vaccine named for the company called the Pfizer-BioNTech vaccine, and it's an RNA vaccine. Now, the important point is that this vaccine has no virus in it. It is not a virus. It cannot transmit virus. It doesn't even have a piece of the virus in it. It is one small strip of genetic material. It's encased within a little fat bubble. So when you inject it into your arm, like you do with any other vaccine, the body sees that piece of genetic material and creates a protein to it. It's a piece of protein. Now, it's that protein that the body recognizes as that outside protein of the virus and then creates the immune memory. So the immune memory is generated from the protein so that at a later date, the body knows its immune response is quicker when it actually sees the real virus. So understanding how this works is a couple of important things. This is not a live virus being injected into us, so it cannot cause and it cannot transmit COVID disease. Now, it is a piece of genetic material, but it is not a piece of our genome. It's RNA. And for those of you who may remember your school background science, RNA does not enter the nucleus of the cell. So this cannot alter our genetic material. There's no genetic material alterations going on here. Now, how effective is this vaccine? Now, I have to say that we have got amazing data on this vaccine now, and I've been in vaccinology now for, wow, 30 years maybe, and this vaccine is looking one of the best I've seen. So the clinical trials you go through and complete have been done on more than 43,000 people, where they give half of them the vaccine and half of them what we call a placebo, which is an injection that does not have the active vaccine in it. Now, on those clinical trials, they were able to show that somewhere between 90 to 95% of people did not have symptomatic COVID disease after they were vaccinated, compared to those who were not vaccinated. It's a highly, highly effective vaccine. I think the exciting thing about this vaccine is it was the same with older age groups. Often vaccines are not quite so effective in older people. This vaccine is looking very good in older age groups. It has to be given 2 doses 3 weeks apart in the upper arm. If you give just 1 dose, you will have some effectiveness. You will have some degree of effectiveness, but nowhere near as effective as you have 2 doses. In fact, there's some really good data coming out of Israel recently where they looked at their data after giving their population 1 dose, and it looked round about 50% effectiveness after 1 dose. So you will certainly see some effectiveness after a single dose, but I would strongly recommend, if you want to be as protected as possible, 2 doses 3 weeks apart. If you miss the 3 weeks and have it a bit later, that's probably fine. There's no problem in having it later, but you don't want the second dose earlier than 3 weeks from the first dose. It's given in the upper arm, and currently it's only offered to people 16 years of age and older. Now, the reason for that is when the first clinical trials were developed, the people who were getting severely ill and dying at high rates of COVID are adults and particularly elderly. So the urgency in the first clinical trials was to focus on the high needs groups first. They are now doing clinical trials on children because, you know, some children do get sick from COVID and we would like to protect our whole population. However, the clinical data is not through yet. So within the next few months, we're expecting more clinical data and we'll be able to make a decision on when and how we can vaccinate children as well. Now, the question that comes up all the time is vaccines normally take 10, 15 years to develop. How come these vaccines have been developed so fast? Have we cheated and gone through shortcuts somehow? Well, the answer is no, we actually haven't. But the standard process to developing a vaccine, where you start with your laboratory studies, your animal studies, you move into small studies with people and then bigger studies, and then important large clinical trials on tens of thousands of people where you compare vaccinated with non-vaccinated have all been completed and gone through their process. So New Zealand has not rushed this decision on this one. The reason these vaccines have come fast is firstly, the world paid attention, science has come a long way, and there was an enormous amount of resources and scientific attention thrown into these right at the start. The virus and the makeup of the virus was given out to the world by the Chinese very early on so that the scientists could start working straight away. Huge international collaboration, and a lot of steps that are usually run one after the other were run all together with just enormous amounts of resources, to be honest. And one example of why we've been able to speed up is traditionally when you design a vaccine, you go through all the process steps, you get your approval from your government through the licensure body, and then you make big manufacturing plants to build them. Well, to speed and to be ready for the vaccines, the world built big manufacturing plants even before they knew if the vaccines would work. Now that's a big risk. They stood to lose millions and millions of dollars by building big manufacturing plants. But the urgency, the need for the world was so great that they were willing to develop things to be ready for when the clinical trial data was through. So in this way, you can see from this little picture here, this is the normal standard process for developing a national schedule vaccine. And these COVID vaccines are following exactly the same process, but they are able to do many of these steps simultaneously, which is why we've been able to get vaccines so fast. Now, the other key important question is this vaccine safe? So for this Pfizer vaccine, we now have a large amount of clinical trials, and the important clinical trial data is the clinical data on over 43,000 people, comparing those who were vaccinated to those that were not. Now, within this clinical data, we know what the side effects we expect after we're given a vaccine are very similar to other vaccines, and there were no other unexpected findings. The important issue to be aware of is incredibly rare cases with all vaccines, you can get severe allergic reactions. Now, that is the reason you're asked to remain under observation for half an hour after receiving the vaccine, just to ensure that you don't have what we call anaphylaxis, a severe allergic reaction. Our vaccinators in New Zealand are all well trained to manage and treat anaphylaxis effectively if it occurs, but we don't want to miss it. So that's the reason you'll be asked to stay for half an hour. Now, not only do we have the clinical safety data, But I think this is the real bonus now of New Zealand having those extra few months. We have safety data now on many, many millions of people who have been given this data, given this vaccine around the world. And so some safety data I can present briefly today is the safety data on more than 12 million doses given in the States in the last couple of months. And out of all those doses, there were no unexpected concerns. They were aware that occasionally, in this case, in around 5 cases per million, which is very rare, you can get severe allergic reactions. And the important thing they've done with these vaccines is that they've actively looked at the background rates across the community of important medical conditions. So autoimmune conditions, neurological conditions, respiratory, cardiac conditions, they've looked at them across the whole population. And then they've said, have the rates of those conditions changed? Are we seeing more? And the answer is no. Out of all this cohort of over 12 million people, they're not seeing an increased rate of all these important conditions. So that's really important that we are actively monitoring that the safety concerns over time across a whole range of conditions. And so that we have got really, really reassuring data that this vaccine is performing incredibly well and its safety profile is excellent. The world plus New Zealand will continue, though, to monitor the safety profile. Always, we do this every time with vaccines to make sure we're not missing anything. So knowing that, what happens after I get a vaccination? Well, many people are fine, and you'll know this from having vaccinations in the past. Some people have no reactions at all. A lot of people with this vaccine will get a sore arm and a bit of pain where you're vaccinated. About 2/3 of people, you will get a bit of sore arm and it may be red and painful. Some people will get muscle aches, some people get headaches, feel a bit tired. This is not at all uncommon after vaccines. We see this for about 1 to 2 days, and if people are uncomfortable, they can use paracetamol or some other pain relief. And I've mentioned the rare side effect of anaphylaxis. Now, are there people who should not have this vaccine? Well, as we've said, the children we don't yet have enough clinical data on, so it's not recommended for people under 16. For anyone who is unwell on the day, you have a fever or you're feeling very unwell, like with any other vaccine, we recommend delaying it. For people, and this is incredibly rare, who may have had a very severe reaction to the first dose of the vaccine or to any component in the vaccine. Now, there's not a lot of components in this vaccine, and the most important one is a thing called polyethylene glycol, which incredibly very rarely somebody may be allergic to. Everybody else is able to have this vaccine. Now, we're asked frequently about pregnancy. Now, in the clinical trials when they were first run, they did not include pregnant women. So at this stage, the safety data on pregnant women is quite limited. Now, this is not a live vaccine, so there is not expected to be any safety concerns for the mother or for the fetus or for the newborn baby. So from a safety perspective, we are not concerned, but because the vaccine was not used in the clinical trial in pregnancy, we still have some caution around this. So the current New Zealand advice is, if you are at high risk and pregnant and you're at high risk of being in contact with COVID, then you may wish to have the vaccine because COVID disease is risky in pregnancy. However, for most of us in New Zealand who are currently not at high risk of being exposed to COVID, if you are currently pregnant, then you may wish just to delay the vaccination till you've finished your pregnancy. There's no concerns and no problems with vaccinating people who are breastfeeding. Is there anyone else who should not have this vaccine? Essentially, people who are older, people have medical conditions, people have problems with their immune system. It's actually really important to have this vaccine. It's not a live vaccine. It's not going to make your condition worse. But people in those conditions are more likely to have severe COVID, so they really need the vaccine. I've been asked about bleeding disorders and whether people who are on blood thinners can have the vaccine. It's the same as when you have the flu vaccine. You can still go ahead and have the vaccine. You just need to ensure that once you're vaccinated, that you put good, strong pressure on the site where you're vaccinated so it doesn't continue to bleed. But it's the same principle as what we do year in, year out for flu vaccine. Now my final slide is what still do we not know? And there are still things, because these vaccines are pretty new, that we still do not know and will not know for a while. I've already mentioned that we're waiting for data for the children. The other thing is we don't know how long the immunity from the vaccine will last. And we won't know that till we watch how these act out there. So at the moment, we've only got a few months data. I'd love to believe that this vaccine is going to last quite a few years, but I don't know the answer yet. The next question is, we know we've got really good data that this vaccine will offer me very good protection, but we do not know if it will stop me carrying it in the back of my throat and spreading it to someone else. So we don't know how effective these vaccines are at spreading this virus to others, even if we're vaccinated. Now, we hope to know that soon, but in the meantime, we have to continue all our other public health measures, all our border protection, all our PPE, and all our other safety measures, because we do not know at this stage how and if we will be stopping the spread to the community. That's what we call herd immunity. So that's what we're waiting to see. So that's the end of my little slide set. Now, there were a few other questions. I would just stop sharing and come back to everybody. So there were a few other questions that were coming through. So, Jane, can I just carry on with the others?
Screen as well. There's several people have been asking how many people have had the vaccine, and I know you've mentioned the 40,000 that were in the study, but obviously, as you can see on the news, millions of people are having the Pfizer vaccine at the moment, but it's often difficult with countries like the UK where they're giving Pfizer vaccines and other countries and other vaccines, and also in America, to know exactly how many of which vaccine are being given. But yeah,
to add to that, Israel, that's just been publishing, has got 60% of its population vaccinated with the Pfizer vaccine. That's a population of about 9 million. America has given nearly 20 million doses now of the Pfizer vaccine. It's being used throughout Europe and other countries, so it's extensively out there.
There's another question here, Nikki, on household contacts of the children, and will they get priority when we do get a vaccine that's suitable for children?
Yes, I mean, that's down the track yet. Of course, it's a few months away. So priority will depend on the situation of the epidemiology at the time. If we're still in border control at that stage, then yes, definitely, obviously, it would be the family of the border staff and the MIQs as we're doing now. We would be hoping by the time we have vaccine for children too, we would have larger supplies of other vaccines available as well.
And then I think these other ones you've sort of covered already anyway, but we're still getting a couple of questions coming through. Side effects, and will they be able to work afterwards, or will my family members be able to work?
Yeah, well, many of us have been vaccinated before, and you know what it's like when you get a sore arm and a bit achy. The vast majority of people just carry on, use paracetamol or some other analgesia if you're uncomfortable. But there are some people who do really not feel well for the next day or two. So there may be some people that might need to take a bit of time off. And the experience internationally so far, both in the UK and the States, most people carry on working and manage fine. But we just can't guarantee that for every individual. And you'll know that from having flu vaccines. Most of us are fine. And then every year you go, gosh, you know, I felt really uncomfortable this time around. So, you know, we can't predict for every individual. Have some paracetamol to hand, though, if you need to.
And this one, I think you have already covered, but just to reiterate, why is it when they've done the studies, are they still not sure whether the vaccine will stop transmission?
Because the studies were done on people who were symptomatic. So the big Pfizer study was done on people stopping having symptomatic disease. You can carry the virus and not have any symptoms. So the original studies did not build that into it because they were totally focused appropriately on reducing disease with symptoms. So at this stage with the Pfizer vaccine, we're waiting for further data. But yeah, because New Zealand's in a very different position because we want to stop spread, whereas the clinical trials were really against protecting people from dying and ending up in intensive care. So, you know, they were much more targeted on protecting individuals.
Right, and then there's a question on interactions with other medications.
Yeah,
so,
there's not expected to be any interactions at all with any other medications. Obviously, people who are on blood thinners, you're putting a needle in your arm, you need to ensure that you've got good pressure to stop bleeding. There's only a very small group of cancer therapy that's usually used for melanomas called checkpoint inhibitors. They're very rarely used in New Zealand. These will be people with severe cancer who are on quite an unusual cancer drug. So if you've been on a cancer drug or you're on one at the moment, just check with your provider before you go ahead and get vaccinated. They're the only ones we've got a caution to. All other drugs, all other medications are fine. And there's no medical group that should be excluded. It is not a live vaccine. You know, we need to vaccinate people with medical problems.
And again, I think these ones have been covered a little bit. Is the vaccine recommended for breastfeeding? I think you've already said that we've no concerns.
The vaccine is definitely recommended in breastfeeding. We have no concerns for breastfeeding infants. I've got a couple here that I could run through as well.
Mm-hmm.
How quickly can we drive or operate machinery afterwards? If you're feeling well, you can absolutely drive. It's the same as any other vaccine. So long as you're feeling fine, you can go ahead with your normal life. And that's the same with exercising afterwards. There's no evidence that exercise is likely to affect the response of this vaccine.
Again, on that line, there's the question here asking about financial compensation should anyone be unable to work because of a side effect from the vaccine.
Yeah, I think that's a question more for the employers than us. But if you had an unusual reaction that wasn't expected, you'd certainly, we could certainly get ACC support as well. There is a broader question: how can we best inform ourselves to spread the latest and most factual data available? At the end of that slide set, I did put up the Immunisation Advisory Centre website, which we are trying to keep up to date with the key common questions and answers, evidence-based materials. So go to the Ministry of Health website or the Immunisation Advisory website, which is imac.org.nz. We really want to keep you up to date because there is definitely a lot of strange stuffs around here. Now, I noticed there was a couple of questions which actually were more pertinent not to this vaccine. So one's asked, can my elderly parents get this vaccine? I've heard in other countries they're not vaccinating over 65s. Now, that is not the Pfizer vaccine. This vaccine is approved and is working really well for the elderly. There is a question at this stage around the data of a different vaccine called the Oxford AstraZeneca vaccine, and they're still waiting for more data on the over 65s. So that doesn't apply to this vaccine. This vaccine is very effective in the elderly. Now, I think there was other couple of questions that were related to another vaccine too. I'll just try and find them. I've lost them. Oh, if you have, I think we've answered the pregnancy one, sorry. Can the vaccine shot make you infectious? No, it can. And can you still pick up and transmit the virus after you've been vaccinated? That's the problem, we don't know yet. Jane, have we got any others?
Sorry, I'm muted. There's a question here about driving again after the vaccine. I think you've covered this as well, but just to reiterate that it's unlikely anyone would be affected to such an extent that they wouldn't be able to drive after the vaccine, and everyone will be asked to wait 30 minutes. So by that time, anyone that was feeling a bit lightheaded or whatever should have recovered fully.
Oh, here's another question I've missed. Can I choose to hold off until one of the other vaccinations are approved, and will I be prioritised? I mean, it's obviously totally your individual choice whether you accept this vaccine or not. I have to say myself that this vaccine at the moment is probably the best performing COVID vaccine in the world. This one and the other RNA vaccine, the Moderna. So if I was offered this vaccine compared to all the others on the market, right now this one has an excellent safety profile. And, you know, its effectiveness at 90 to 95%, you will not get better out there from any other vaccine on the market at the moment. Over time, we'll know more about all these vaccines, particularly how long they last. And, you know, we may well eventually have to boost, and, you know, you may well be offered different vaccines later on. But at this stage, we're very fortunate to have one of the best world vaccines there is as our first vaccine.
There's a question here about the 95% effectiveness in comparison to other vaccines that we currently use. I think that's quite a nice one to answer, because that's one of the
it's really interesting, isn't it? I have to say that when I was watching the early development of COVID vaccines, I was assuming they would act more like flu vaccines. Now, flu vaccines are effective, but only around 50 to 60%. A lot of respiratory vaccines are not brilliantly effective. So these vaccines, I think it's about modern technology being very effective, honed in on the specific part of the virus that's important. So these vaccines are performing very well, pretty similar to the measles, mumps, rubella vaccine in terms of how effective they are, which is the most effective vaccines we've got. We will not get more effective than this. What we will want to know is how long they last. That's really the big question.
And there's a question coming, Nikki, how long after the vaccination before it's effective?
Oh, really good question. So we say up to 14 days. You get an immune response 7 to 10 days. By 2 weeks, it's kicking in with a good immune response. And then remember, at 3 weeks, you come back for your second one. So 2 weeks after the second dose, you should see a good immune response. There is also a question about flu vaccine that's coming along soon and COVID vaccines. So we're still recommending strongly flu vaccine. Because we don't have any data on delivering the 2 vaccines together, we're recommending making sure if you have one vaccine, you have a 2-week gap till you have the other vaccine.
I'm just reading through because the questions are coming in thick and fast, some of which we've already covered.
Brilliant.
I think there's a bit of a misunderstanding here. If the vaccine was tested on those people who were symptomatic, how will we know that we won't get sick? It won't make those that are well sick. I think
Right.
what Vicky, what you meant was they were testing after the vaccine had been given to see whether it was working.
Yeah, and interestingly, so you give vaccines to healthy people. Everybody, all the 43,000 were healthy when they were given, and then you watch and see what happens when they get exposed to COVID. Because there is so much COVID around in the world where they were running these vaccine trials, they actually got their results very fast because there was so much COVID around, and a lot of the non-vaccinated got severe COVID.
Right, so there's a question here asking what equipment we'd have available to deal with emergencies before the ambulance arrived. So just to reassure everybody, we would of course have the relevant drugs available, and all the staff that give the vaccines are suitably trained in appropriate emergency management techniques, and there'll be plenty of people around observing. So very skilled team.
I do want to add to that to say to people that we are used to the very rare event of severe allergic reactions. You know, we're healthcare providers. We see that with all medications we use, and we're used to managing it, and New Zealand manages it very effectively. So it's very rare, and we manage it when we need to.
So effectiveness of the vaccine once you're over 65.
Yeah, really good question. So this vaccine, so far, both the clinical trials and the recent data that's coming out of Israel, which is the country that's got the most vaccinated in the world, and coming out of America, is showing that it's as effective in people over 65 as in younger people, which is pretty remarkable. Now, some of the other vaccines may not work like that, but this Pfizer vaccine is looking very effective in older people. It's possible, of course, if you've got an immune system that's not working so well, it may be a little less effective, but it'll still have some effectiveness. So the importance of offering it to everybody, even very elderly, people with severe immune problems, you should get some effectiveness from it. We just can't always guarantee it's complete.
There's a question on the biological source of genetic material in the
That's what I saw before. Now, that's not related to this vaccine. That's related to the original cell line with the vector vaccines that we don't yet have in New Zealand. So this vaccine was not designed with any cell lines. So when you design some vaccines, a virus needs to live inside it. It can't just live by itself. So in the laboratories, they start with a living human cell that they have usually 20, 30, 40 years earlier got into the laboratory. Now, this is not this vaccine. It does not have any cell lines associated with it. This is related to the Oxford, AstraZeneca, and Janssen vaccines that we may see later in the year in New Zealand. And even if they start with the cell line, there's no cell line left in the vaccine. It's just the original origin of how they grow the virus.
We've had a few questions about flu vaccines and the spacing between flu vaccines and the Pfizer vaccine, and why you shouldn't have the two together.
Right, yeah, well, I mean, they're probably fine being given together, but the thing is, once again, the clinical studies, we normally do clinical studies where we give them both together and we check the safety and effectiveness. Now, at this stage, that hasn't been. So at this stage, because there's not such an urgency, that we recommend that you have a 2-week gap so you know 1 week is working, so that you know one vaccine is working, it's had a good 2 weeks to work biologically, and then you have the other one. So that's the reason we're currently recommending not giving them together. In future, we will have clinical data. Most vaccines are absolutely fine to give at the same time. This is just us being very cautious when we haven't yet got the clinical data to be saying, yep, it doesn't affect the effectiveness of the other and it doesn't affect the safety of the other. So until we know that, let's keep the 2-week gap.
And we're actually recommending 4 weeks between other vaccines like the MMR and HPV.
Yeah. So the MMR, because it's a live vaccine, the immune response takes a bit longer to happen. So the live vaccines in particular, we recommend any other vaccine that's not so urgent to deliver, we recommend a 4-week gap.
So the advice on breastfeeding women and vaccination, is it based on data from studies or simply scientific plausibility?
No, it's a very good question. Scientific plausibility. So that the clinical trials didn't include breastfeeding women. The rollout all over the world of, umpteen million has been including breastfeeding women. So no, we already have data on at least 12 million in America, or data in the Israeli cohorts. So we only have small amounts of data on breastfeeding, but we're accumulating data. We only have small amounts of data on pregnancy because we're being very cautious. But a lot of breastfeeding women are happily vaccinating. And you're right, biological plausibility, there is absolutely no reason why there would be a concern.
There's a question here, will we need to vaccinate the next generation, or does the memory pass on to the next generation? Wish it was
that question. That is
a lovely
such a
question.
Cool question. Yeah, no, I think your immune memory is only to the individual. So no, we will have to continue. I suspect we're going to have COVID with us for a very long time. It'll probably end up being part of our standard winter respiratory pattern. And yes, I think it's very likely that we will have to vaccinate for a long time. Really good question.
The person that wants lollipops after the vaccination session is probably going to have to bring their own, I'm afraid.
Oh, it's such a lovely idea.
Yeah. There's a few questions about which sites are going first and whether there would be compensation if you weren't able to go in if you were symptomatic afterwards. More sort of work-related ones than vaccine-related questions. So I'm not sure.
I'm sorry, we're the clinical people here. We can't really answer the work-related stuff so easily. We'd have to ask the DHB folks for that answer.
As far as the recording, will that be available for people to listen to later?
I believe, yes, I can see that this is being recorded now, so absolutely.
Okay. I'm just checking through. I mean, I don't anticipate that a lot of people will need time off. There's questions about whether the rosters should be staggered to ensure that there's enough staff well to work. I think
once again, we're not the first country doing this, and this has not been people's experience that people need a lot of time off. So I don't think this is a major concern. I have no reason to believe New Zealand would be different from the UK or from the USA or from Israel, that it doesn't seem to be a large problem in practice.
And we'd have no reason to think it would interrupt with any contraception, would we?
Not at all. Once again, it's the same with any other medication. There's no biological reason why there would be any interference.
And certainly vaccines are not mandatory, but sorry, Nikki.
Sorry, I was going to say there's also no biological reason, any plausible mechanism whatsoever as to why it could affect fertility either.
Good point. Again, comments about the vaccine not being mandatory. It's certainly not mandatory to have the vaccine, but employers may have particular rules around that, which is nothing that we have comment on, I don't think. Yeah, we've got that one. We've done fertility. We don't know when the decision will be made on the children. That'll depend on the data coming in, won't it?
Yeah, it really depends on the data, and we don't have any control over that. So it's probably several months.
And if people want more information?
Yeah, it's a really good question. So I think, once again, there is information on the Ministry of Health website. I hope that the DHB can circulate the video from Dr. Ashley Bloomfield talking specifically about this vaccine, but also on the IMAC website, we'll also get a link up to that video. So it's www.immune.org.nz. You also ring Healthline, and if you're a healthcare professional, you can ring the Immunisation Advisory Centre 0800 Immune line as well if you want further advice for further information. And I'm sure you're all very aware out there that, you know, go to reputable sites. There is, you know, a small group of extremely noisy people who make a lot of noise about stuff that absolutely has no science basis to it whatsoever. So if you're scared or concerned, do try and go to a reputable site, or give us a call on the phone line.
Somebody's asking if they should postpone the vaccine if they're feeling a little unwell.
It's the same rule as any other vaccine. If you're feeling mildly unwell, no, don't postpone it. You've got the vaccine here to make the most of it. If you're feeling very unwell, if you've got a fever of 38 or higher, or you're extremely unwell, then do postpone it. But mild illness, lots of us have got hay fever, you know, sort of low-grade illness, go ahead and vaccinate.
As far as testing is concerned, until we have more data on the whether it stops the transmission of the virus, the testing will continue. Managed isolation, won't it, as normal?
Yeah, that's correct. We can't let down our guard at this stage until we know how effective these vaccines may be against transmission. We absolutely know they will protect us as individuals. We just are not sure yet whether they will stop me spreading the virus to you. That's really a crucial question for New Zealand.
So can you still catch the virus if you haven't had your second vaccine?
Yeah, so it's not as effective with a single vaccine. So you will have some protection after a single vaccine. And if you caught the virus, you may still get sick, but hopefully it'll make you less sick. A second vaccine just makes your protection much stronger. What we don't know, even after 2 vaccines, is whether you can still carry the virus and spread it to someone else. That's without getting sick. So that's what we're waiting for more data on.
We also don't know how long it's going to be effective in our systems at the moment, do we? So we don't know how long it's going to last yet.
We're hoping a few years, but we really don't know at this stage.
So what are the quality assurances on the vaccine? Will that be MedSafe?
I think that's the question for MedSafe. So one of the, so the New Zealand MedSafe, which is the authorising body to approve these vaccines, they go through line by line all the data, the clinical data on the manufacturing plant of these vaccines, on the stability of the vaccines, on how they've developed. And then when they're shipped, they have cold chain monitors with them to ensure they stay within the right freezing temperature. And then when they move from the freezers out to the sites of vaccination, they're also monitored. So they're monitored all the way through, but certainly right at the start, there's a whole lot of quality assurance around which manufacturing plants New Zealand would accept as being adequate and appropriate, and whether they've been properly audited. New Zealand's pretty tight on this. We're very fortunate to have a pretty strong licensing body with MedSafe. So we don't just accept other licensing body decisions, we go for our own as well. So you've got a sort of a double protection that the Americans have approved this vaccine, the Europeans have approved it, the British have approved it, many other countries have approved it, but New Zealand went ahead and looked at our own approval process as well.
So there's a question here, it's a difficult one to answer. How many doses of Pfizer vaccine has been purchased at the moment? And it's more a case of how many have arrived in the country. And if I refuse the vaccine now, will I still be able to get the Pfizer vaccine later?
Yeah, so that's more about supplies really. So my understanding is there's about 60,000 approximately doses. And this first amount of Pfizer vaccine, we're expecting about somewhere around 1.5 million doses. And of course, that's for 750,000 people. And then there'll probably be a bit of a delay before we get other vaccines in. So if you did turn it down, I can't guarantee, we can't guarantee if you're able to access another Pfizer vaccine, but later in the year, we will be expecting large supplies of other vaccines as well. So you may just have to wait quite a few months till we get more vaccine supplies in.
And then asking whether the frequently asked questions will be available in different languages, for which the answer is yes, we do want them in different languages, but timescales.
Yeah, with that question, we'd like to see them in different languages, and probably that might happen a bit late, I suspect. And that's a question for health.
Which country is the Pfizer vaccine manufactured in? It's more than one.
Oh, yeah. It's not just a single country. It's got manufacturing sites in several different countries. And you know, I don't want off the top of my head to say which ones they are, but there's certainly sites in Europe. I believe Australia, I think Australia's got a site. But look, I might be incorrect, but there are several sites around the world. And if somebody really wants an answer to that, please just ask us later and I'll check and get back to you.
Just to reiterate that you will still need to do the COVID testing even if you've had the vaccine for now, until we establish whether or not it stops transmission in people that don't have any symptoms.
Yes.
And can we clarify actions to take post-vaccination symptoms, if symptoms are experienced with those that, will people still need to self-isolate and get COVID tested?
Yeah, that's a really good question. I was asked that earlier too. So most of these symptoms are about sore arms and feeling achy. That's not a COVID disease symptom. So the majority of symptoms, you'll know that's a vaccine-related symptom. This vaccine does not cause respiratory symptoms. So if you get a cough and respiratory symptoms, then most definitely check for COVID. Because, you know, it is quite possible that you might have had COVID even just as you were about to be vaccinated. A small amount of people will get a fever. My assumption is that if you get a fever in the day to two after a vaccine, but you have no other symptoms of COVID, you don't have any respiratory symptoms, you don't have any other symptoms that are associated with COVID, then that is likely to be a vaccine reaction. If you're not sure, of course, you can get a COVID swab.
Yeah, and Healthline is a good point of call, isn't it? If you've got any concerns and you want some advice. So that would be where you'd initially report any side effects to as well, and then if necessary, go and see your GP. Just a question here, as we hear about all these different variants coming out, will we need extra vaccines?
Yeah, really good question. So this Pfizer vaccine, as far as we know at this stage, is effective against the English variant, which is a relief for all of us currently. And it does look like it's pretty effective against the South African variant. It may be slightly less effective, but it's still extremely effective. Now, there will be other variants coming along, and little spike protein on the outside does evolve. Now, these vaccines have the ability to be changed very rapidly, and they can, in response. So if there is a significant alteration in the virus, alter the vaccines and churn them out in a new one, a bit like what they do with flu vaccines now. So yeah, they may have to update the vaccine formula if the viruses do mutate more. At this stage, we're pretty confident that this vaccine is looking pretty good against the variants.
There's a question here about level 3. Will we continue with the rollout program if we stay in level 3?
Well, we'll certainly be continuing with the vaccination program in the weekend. That won't stop. My understanding is we see that as high priority. Yeah. We're going to stop that, you know, particularly for you folks who are on the front line. Right. We will continue with that, but of course it would be continued with all the caveats around the levels.
Vaccines stored at freezing temperatures, how do we know they'll get it right?
Yeah, well, they monitor. You know, yeah. Got to rely on, this is back to the quality control question, which is a very reasonable question. So that they are, these very deep freezers are monitored very closely, and so is the storage all the way through on the plane and out to the deep freezers. And then once you take them out of the deep freezers, we've got up to 5 days within the standard cold chain that we monitor within a standard cold chain. So that's very much about us getting our quality control issues right.
And that's something that we're doing all the time with vaccines, isn't it?
Yeah.
How would people be updated if there were any safety concerns raised by the data coming in from other countries or from our country?
Yeah, that's a really good question. So at the safety, if there was a significant safety concern, it would come through MedSafe, and MedSafe would announce it as a government announcement. So if there really was an important safety concern, it would come through MedSafe, it would go through the government, it would be announced through the Ministry of Health, and I'm very confident it would come out through Dr. Ashley Bloomfield.
Still a couple of questions on management of anaphylaxis, but I think we've covered those already in terms of being well prepared and experienced and used to dealing with these situations very efficiently.
Yeah, so just to remember that primary care providers are used to managing severe allergic reactions because they're more common with medications than they are with vaccines. So every primary care provider, general practitioner, nurse in New Zealand has to manage these emergencies because we see them with medications. way more commonly than we see with vaccines. So we are well trained to manage them.
And then there's a question here, are we still likely to be able to have clinicians answer questions in person at our, for our port workers, forums, seminars and such like?
Oh, that's a lovely question.
That's a nice one. Yeah.
That's a really nice question. I hope so. I think, you know, it's good for us. We really like the questions. So I really hope these sort of forums can continue.
And of course, all the vaccinators will be well trained. And so they should be able to answer most of these sort of questions that have come up today should be things that things that are included in our training. So you can always ask the person that's giving you the vaccine, you know, before they stick the needle in you. And the proposed time frame for getting these vaccines delivered to border workers and those in managed isolation?
Well, that's about district health board rollout. So in Auckland on Saturday, and then it's rolling to the other district health boards. There's a set process for that, and I don't have it in front of me at the moment.
And then there's the one here. Basically, is this still experimental if it's not 100% effective?
Yeah, well, we've never ever and will never ever have 100% effective vaccines. Nothing is 100% effective. And nothing ever will be 100% effective, because this is about an individual creating their immune response to what is presented to them. So you will always have a small amount of individuals who don't fully respond. This is seen with every vaccine. This is one of the most effective vaccines. So we have most vaccines are around about 70, 80% effective. So this vaccine, as we said earlier, is a highly effective vaccine, but it is about my immune system, your immune system responding to the vaccine and creating an immune response. Sometimes, for a whole lot of reasons, it just doesn't happen with some people. We're just incredibly pleased to be able to say it's very rare with this vaccine. And it's not an experimental vaccine. It's well used widely in millions and millions of doses around the world now. So huge advantage of New Zealand not being the first cab off the rank. We didn't have an emergency. We could wait and take our time and check that we are really comfortable with the data around this vaccine. And I have to say, I will be lining up for this vaccine as soon as it's available, because I'm really impressed with the data.
Yeah, me too. A couple of people asking about certificates after they've been vaccinated. And I think the plan is that we will have a little card that people will be given to say that they've had their vaccine. That's the latest I've heard. Is that the same with you, Nikki?
Yeah, I don't know more than that.
Yep. And so do we contact Auckland DHB directly with questions around the rollout for border workers?
Yeah.
Yeah.
So we're not entirely sure of the logistics of the rollout.
A question here whether there will just be nurses present at the vaccination session or if there will be medical staff. I think in a lot of settings it'll be a mixed model, won't it? But
yeah, I think initially there'll be medical staff as well. But to be quite honest, our nurses in New Zealand are the best trained in the world, and it's our nurses who will deal with any problems, and medical staff will be either on site or very closely available. It's the same with all our vaccination programs in New Zealand. New Zealand's got a fantastic track record of safe and effective vaccination programs.
Yeah. A question here about oxygen no longer being a requirement at the session, and is that a concern for these ones?
Yeah, so this is a question we've been under discussion for a long time. This is not to do with COVID vaccines, but traditionally many years back it was decided that oxygen should be present in case you had a severe allergic reaction. Now the data from all the experts in this area is that the treatment for very severe allergic reactions is adrenaline. And it's not oxygen that's needed, it's adrenaline. So the decision has been made that it's way more convenient for a vaccination clinic site not to have to carry oxygen, so that you use adrenaline and you use adrenaline effectively and you transport the person to hospital. So this is a decision that was made well before COVID vaccines about managing severe allergic reactions in general. And New Zealand's pretty comfortable now with its recommendation on this.
There's a recommendation. There's a question here about would we get a stamp in our passport to say we've had the COVID vaccine?
Yeah,
no, you're not going to get that. It's a very good question.
It's a really good question, eh? I mean, this is a really hotly debated topic around the world at the moment. So watch this space. I mean, I find it quite fascinating.
Yeah.
One of at the moment is there's not enough vaccine in the world. So it would be really unfair that while a lot of the world can't get vaccine, to have a vaccine certificate in sport. But I think in the future, it's going to be a very interesting question.
But we do have a COVID immunisation record system, so it will be recorded who's had the vaccine. So, you know, if in future that was a requirement, it would be very easy to track down who'd had it, which dose, when, and all the rest. It's all being recorded on a national database.
And just to reassure people that we have a national immunisation register now. It is now turned into COVID immunisation register. That is your confidential, safe advice about your vaccination event, and it won't be used for anything else. It's been the same in New Zealand for as long as we've had an immunisation register. It's not there for any other purpose, just to know that we have recorded that people have been given vaccinations.
I think we're pretty much at the end. We got to the point where we're being asked the name of the dog. Disrupting my
Yeah, what is the name of the dog?
That's Ginny. So yeah, apologies for that, folks. This comes from working from home. Yeah, I think the other questions that we've had through, we've either answered or ones that we can't answer because they're work related.
Right. Hey, thanks so much, Nikki and Jane, for your time and the excellent presentation.
Right.
Thanks, Ian, for joining us today.
And thanks everyone for your great questions.
Yeah, thanks for your time and your questions.
All the best for the weekend vaccination.
Yeah, all the best. Bye.